Nurses and midwives are key to the achievement of WHO's goal of universal health coverage because they play a critical role in health promotion, diseases prevention, and the delivery of care in all settings. More details in the following report. The World Health Organization has declared 2020 as the year of nurses and midwives, and World Health Day this year is dedicated to the same theme. On this day, His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, expressed his warmest thanks to the nurses and to all healthcare workers.
On the occasion of the World Health Day, it gives me great pleasure to express my sincere thanks and gratitude and appreciation to all the staff working in healthcare, doctors, allied healthcare professionals, and administrators. In particular, nurses and midwives, since this year is being designated the year of nurses and midwives by WHO. What you have been doing so far to combat COVID-19 has been great and helped a lot to slow down the progress of COVID-19. I urge all of you to be very careful, to protect yourselves, to minimize the risk of acquiring this infection. You are the safety net for our healthcare system, and without you, there will be no healthcare system. So I repeat my thanks and appreciation to all of you, and I urge you again to be extremely careful in dealing with any patient who you should always suspect of having the virus until proven otherwise.
Dr. Ahmed Al-Mandhari, Regional Director of Eastern Mediterranean Region, also said,
WHO has made 2020 the year of the nurse and the midwife. And this year's World Health Day is dedicated to the same theme. Health workers, including nurses and midwives, have a crucial role to play in helping countries achieve universal health coverage and ensuring that no one is left behind. On the 7th of April, WHO is launching the first ever State of the World's Nursing Report, which presents up-to-date evidence on the nursing workforce globally. And next year, we'll see the launch of the third State of the World's Midwifery Report, providing updates on progress and future challenges to ensure effective coverage of midwifery services.
He added the two reports will inform national action to strengthen the nursing and midwifery workforce to advance towards universally health coverage and achieve the Sustainable Development Goals by 2030.
This year, 2020, it is dedicated to the nursing profession under the theme, Support Nurses and Midwives. Messages are sent to the public in order to show appreciation to the nurses and the nursing profession, and to the policymakers in order to induce changes and strengthening the nursing profession.
And on the occasion of the World Health Day today, and in recognition of the nursing and midwifery work, I would like to congratulate nurses who are practicing in infection prevention and control and give them a big thank you for their excellent work and in keeping the frontline healthcare workers safe by ensuring the right practice of infection prevention and control.
We are proud for all healthcare workers working in the healthcare institution. We are extra proud for all nurses working in the COVID wards in all healthcare institutions. As being a nurse, infection control nurse, I'm also congratulating our colleagues in the infection control field.
The importance of nurses and midwives is clearer than ever today. As the world faces the novel coronavirus pandemic, health workers, including nurses and midwives, are working tirelessly day and night, risking their own health and well-being to care for their patients and save lives. Abdullah bin Ahmed Al-Rabi'i, Sultanate of Oman Television, Muscat. Now, to learn more about nurse and midwife's role in the Sultanate, with us live on telephone call is Dr. Jamal bin Eid Al-Khuduri, Director General of Nursing at the Ministry of Health. Dr. Jamal, can you hear me?
Yes, Assalamu alaikum, Abdullah.
Wa alaikum assalam. Welcome to our television news at this particular time. I know you are quite busy there, But thank you for joining us on Oman Television.
Thank you for the invitation.
Now, every 7th of April each year, the WHO marks the importance of the World Health Day with a specific theme to highlight its importance. This year's theme is to support nurses and midwives. Dr. Jamal, why in particular nurses and midwives?
Bismillah ar-Rahman ar-Rahim. Nurses and midwives are the backbone of any healthcare system. The more supported, the more taken care of the nurses and midwives, they play a bigger role along their colleagues to produce and introduce healthcare that impacts the community, individuals, and promotion of healthcare all over populations. The current year has been dedicated to nurses and midwives, and their support is a recognition of the WHO and the whole world that universal healthcare is important, and nurses and midwives have been playing a great role in ensuring that the best care is provided for individuals and for communities, and that this is something that they would like to continue, especially considering the great shortage that's being expected and is current in a lot of countries throughout the world. The WHO is expecting to prepare and develop around 9 million nurses by the year 2030. And that's a great need and a great challenge for all countries. And that only ensures that without well-prepared, well-skilled, and effective nursing and midwifery services in any healthcare system, the health of individuals are not going to be sustained, and it's something that should be taken seriously and supported throughout. This year has been marked for the support of nurses and midwives because they play an effective role and an important role where they are involved from the beginning of the life of any individual all the way to their death. They're involved within community services. They're involved within promotion, and also they're involved in taking care of individuals within hospital setting and critical care setting. This multitask types of healthcare services actually have a great impact on maintaining any healthcare system to support and address the needs that emerge with any challenging situations. And this is what this challenge and crisis with COVID-19 pandemic, it proved that nurses raised to the occasion, and they have showed that they are capable and they were prepared for such occasions by participating in health promotion of the healthy and prevention from transmission to individuals that don't have it. In the whole efforts and tasks in quarantine and taking care of individuals who are positive with COVID-19 at different levels, whether it's mild, moderate, or individuals that require intensive care in severe situations.
Indeed, they have got a great role to play in taking care of all the cases, actually. Now, COVID-19 has caused pressure to the healthcare services throughout the world. How is Oman managing with its nursing and midwives staff, along with other healthcare staff?
As I said, Abdullah, with every challenge, nurses always prove that they are capable of raising up to that challenge. Here in Oman, all the steps and the efforts and the support that has been given to the healthcare workers, and especially nurses and midwives, from preparation in terms of education, through the Nursing Institute, the College of Health Sciences, the colleges of medicine, and Sultan Qaboos University and other universities, where nurses were educated at a level which is consistent with international standards, proved that those products of nurses and skilled individuals were able to adapt and develop a system and contribute to become the most important part and contributor to health services. And when this pandemic came up, it proved that they are ready, and they worked very hard at all levels. And with us in Oman, this level of education at all different times within the history of healthcare, and especially nurses and midwives, nurses at this point in time are ready. We have over 15,200 or more than 15,200 nurses and midwives in the country, and they constitute 60% of the healthcare workforce, where 64% of which are Omanis, who are qualified with a diploma, bachelor's, a master's, and a good number of PhD degrees, and who are able to work within leadership levels, management levels, and practice.
Go
ahead.
Wonderful. Dr. Majid, Dr. Jamal, now where does, at this particular point, where does nursing and midwifery stand in Oman? You have pointed out there, but in general, where do they stand at this particular time?
I think we're doing very well. I think we are at 64% Omanized in the country, and they addressed most of the needs that we have here in Oman. We would like to have probably more support in the sense of increasing maybe more educated nurses. But actually, in terms of our needs, I think we have enough nurses to deal and manage challenges that are coming up. And especially so far, our nurses are doing a great job in terms of managing the current situation.
Well, thank you very much, Dr. Jamal. First of all, again, here we would like to congratulate all the nurses on recognizing them that this year is for them and their colleagues, midwives. We would like also to congratulate you for taking up this new position. We wish you all the best there. And we would like to congratulate all the nurses once again for being heroes on dealing with COVID-19. Once again, thank you. That was Dr. Jamal bin Eid Al-Khuduri, Director General of Nursing at the Ministry of Health. Along with other healthcare professionals, here are nurses and midwives at the forefront of caring and curing the people from COVID-19 infectious diseases, and they have this to say.
COVID-19 pandemic has an unpredictable challenges that nurses face it on daily basis. But we are still here, even during the social distance, providing nursing care. My role as a team leader to provide a maximum support to all the nurses and to direct them for the safety of all. I'm proud to be a nurse.
I am a nurse in charge of cardiac cath lab and intervention radiology. As a nurse, and since the outbreak of the COVID-19 was declared a pandemic, we are prepared to work wherever needed. Thank you for staying at home and following all the precautionary instructions.
As frontliners, despite being at high risk, we ensure that we all follow proper guidelines. We wear all required personal protective equipments. We provide support for each other and work as one team.
I am an emergency nurse, and as emergency nurses, we are always the frontline responders to the COVID-19. Our preparation started since the beginning. Our main goal is to provide care for the patients who require emergency services, including COVID-19.
As critical care nurses, we are said to be at the epicenter of coronavirus crisis. Urgent preparation have been underway to boost all intensive care needs. As a team leader in ICU, and in order to match the increasing demands that COVID-19 pandemic will place on critical care services, different critical strategies have been implemented to ensure both patient and healthcare worker safety.
Robust leadership is essential in nursing work environments, and particularly at this time of COVID-19 crisis. My role as a leader, I need to make sure the safe practices applied to patients, and at the same time, the nurses are protected. Keep up the hard work, and God bless you.